All right, you're called to a 25-year-old male with significant bleeding from a table saw accident in his garage. The saw stops. The scene is safe. You have good entry and exit. The MOI is a DAVC approach. No allied agencies at this moment, and full PPE is recommended.
Okay, so I'm not going with full PPE, water droplet, air droplet. So I'm walking up to my patient. He's sitting upright. He's interacting with me and my patient. Do I see any cyanosis, pallor, or mottling?
You see pallor.
Okay, work of breathing. He's breathing in any abnormal sounds at all?
Nope.
Okay, so I'm not introduced us. So, hi, I'm Dave, my super paramedic. This is my partner. Are we okay to help you?
Yeah. Yes, please.
What's your name and age?
I'm Nick and I'm 25.
Okay, so can you tell me what happened to you today?
Yeah, I was building a boat with my table saw and I cut myself.
Okay. Have you been sick in the last 2 weeks at all?
No.
So second Friday, we're going to keep everything on. Did you hit your head, neck, or back at all?
No.
Okay. Can you tell me where we are right now?
In my garage.
Can you tell me your full name?
Nicholas Tolliver Wells.
Can you tell me what month it is?
It is November.
So a patient is alert and oriented times 4, A on the APU scale. We're going to follow the DAVC scale flow. Do I notice any bleeding on the body at all?
Yep, on his left arm.
Okay, can you put a tourniquet on him? Do you feel any wetness other than your arm at all?
No.
Okay, so I'm going to do a full blood check, bleed check just in case. So have you lean forward a bit. Okay, I'm just going to assess your airway now. So take you open your mouth for me. Do I notice any blood secretion, anything like that?
Nope.
Okay, can you smile for me? No facial droop at all, and no slurred speech from talking to him earlier. Next, I'm just going to check the breathing. What's the respiratory rate for him? Take a deep breath for me.
It's fast, regular, and non-labored.
Okay, equal air entry. I'm going to also take for the chest, for the back of your lungs now. Can you take a deep breath in for me? Okay, I don't hear any adventitious sounds at all. Next, I'm just going to check trachea. Can you look up for me? And then can you scoot forward and look up to your right for me? Trachea is midline and JVD is absent. You can go back to normal. I'm going to check for subcutaneous emphysema, non-present. So I'm going to be checking pulses for both radials. Present.
It's fast, regular, and strong.
Okay, I'm going to check the carotid as well. Same as the radial.
Yep.
Okay. Next, I'm going to palpate the abdomen, looking for any masses or anything. Any pain at all when I do this at all?
No.
Okay, I'm also going to do a pelvic check. Pelvic is stable.
Yep.
Next, I'm going to check for peripheral edema. Is there any present?
No.
I'm also going to check cap refill. Is it present on both?
Yeah, brisk on the right, slow on the left.
Okay. So this will be. Did you hit your head, neck, or back at all?
No.
Do you have any neck pain or back pain at all?
No.
Are you able to walk to the
Yeah.
stretcher for me? So this is going to be CTAS 2 to the local trauma center. My partner's going to drive while I do my secondary assessment. I'm going to be looking for at the head for contusions, colors, cyanosis, lacerations, abrasions, asymmetrical motion, abdominal breathing, punctures, penetrations, penetrating objects or organs, swelling, subcutaneous emphysema, sucking wounds, deformities, distension, diaphoresis, and dry blood. And then I'll feel for tenderness, instability, subcutaneous emphysema, swelling, and deformities on the head. Are you able to run your tongue around your mouth for me?
Yeah.
Do you feel any broken teeth or anything like that?
No.
Okay, I'm gonna check the ears for blood or cerebral spinal fluid or any bruising, anything up the nose, anything there. Can you also bite down and see if is there any pain when you do that?
Nope.
Okay, I'm gonna be checking the neck for TLAPS D and TIPS D. I'm gonna check for step off deformities, and then can I get you to look up? Trachea is still midline, and then look over to my finger. JVD is absent. Next, I'm gonna be checking the chest. I'm gonna be looking for TLAPS D and TIPS D. Present, I'm gonna check if the sternum is stable. I'm also going to also take the 4 front quadrants. Take a deep breath. Okay, no adventitious sounds at all. Next, I'm going to get you to lean forward. I'm going to check for the back, the thoracic, and lumbar support spine for any step-off deformities. Nothing there. I'm gonna be checking CLOPS, D, and TICST on the abdomen. I'll be palpating the 4 quadrants for any rigidity, tenderness, or darting. I'm also going to do a pelvic check. Pelvic is stable. I'm also going to be palpating the groin. Do you have any wetness or anything?
No.
Any priapism?
No.
Okay, and that's when I'll be checking the CLOPS, D, and TICST on the legs. Anything there at all? Then I'll be checking. Can you push on my feet for me? On my hands? And do I feel pedal pulse?
Yes.
Okay, can you close your eyes and tell me how many times I press on your feet?
2 eyes.
Yeah. Okay, no ventral braces, anything, cap refill is present. I'm gonna be checking. Can you move your fingers for me? And then can you close your eyes and tell me how many times I press on your hands?
Once.
Yep. And then I'm gonna be checking radial pulse as well. Is it present?
Yep.
Okay, so this will be CTAS 2, so local trauma center.